Hi everyone, my name is Brad Gellert. I'm the manager of the Policy and Advocacy Unit in the Cancer Prevention and Advocacy Division. If you're not familiar with the work that my team does, our goal is to influence public government policy, funding, and programs to reduce the impact of cancer. And we do this primarily through policy analysis and research, building relationships in government, and through community advocacy. And today, I'm really pleased to be able to talk to you about a pre-budget submission that my team have made in the past few weeks. And let's start by talking about, well, what is the New South Wales budget? What is a pre-budget submission, and why does it matter? Of course, advocacy is really one of our big levers for achieving our vision of a cancer-free future, which is why we're ramping up our advocacy efforts, in particular in the lead up to the New South Wales election. And so let's start by talking about the New South Wales budget. So I guess like any other organisation or company or entity, governments start each financial year by setting a budget. So in New South Wales, the total budget is enormous. The health budget alone annually is around $30 billion. And the budget outlines all the government expenditure, all the money that flows to agencies and departments, for pretty much everything the government does, and increasingly along with the outcomes that the New South Wales government wants to see for the money that it spends. Budgets, kind of, I guess, unlike organisational budgets, for government, have a really strong political element to them too, particularly because in New South Wales, where we're almost sort of just over 12 months before a state election, so there is a political dimension to budgeting. So government does look at, they do look at making, I guess, in a sense, captain's calls, depending on things that they think might sort of carry favour in certain sort of parts of the community. And I guess Cancer Council and other NGOs kind of have a part to play in that process. So pre-budget submissions are essentially pitches for a slice of that huge budget. So it's not too dissimilar to what the work of the philanthropy unit do when they pitch to major donors, philanthropists. Here, non-government organisations, other organisations make submissions to the New South Wales Treasury for things that they believe should be funded in the next financial year. And so Cancer Council New South Wales this year has made a pitch to New South Wales government, and it's the first time I think that we've done this in, like 8 years or something. So it's really exciting. In this pre-budget submission, we focused primarily on two areas. So the first area we ask the New South Wales government to support the mental health and financial well-being of people with cancer. And we ask them to do this by providing funding so that Cancer Council New South Wales can scale up its counselling services and our financial counselling services. The second goal that we focused on is really to make it easier for people in regional New South Wales to be able to access cancer care. And specifically, we are asking the government to help do this by looking at its subsidy program that provides financial payments to people who have to travel really long distances from the country into major towns to receive cancer care. Specifically, we want to see those subsidy rates increased, and we want to see the number of people who can access travel subsidies expanded too. And so why have we focused on these particular areas? Well, as you'll see, these two areas, that that's certainly not an exhaustive list of all the policy areas that we think the New South Wales government needs to take action on. We have a very sort of long and comprehensive advocacy agenda, but the reason we honed in on these particular areas is that we really believe that with government funding, they can make an immediate impact on the lives of people with cancer in the next financial year. And we know, because we're leading up to a New South Wales state election, that the government really is looking for use of a better phrase here, quick wins. Um, so, so sort of reading the landscape, we think that focusing on these two areas, and then ramping up our advocacy in the lead up to the election, is the sort of right approach. And so, if we hone in on that first goal to support the mental health and financial well-being of cancer, look, really, we know that in the past sort of 2 years, COVID-19 has had an enormous impact on the emotional, financial well-being of people with cancer. Existing government services are stretched. We knew that there were gaps pre-COVID, but COVID has really exposed those gaps. And we know that Cancer Council New South Wales services are effective. They can be scaled up, and if funded, have the potential to reach hundreds more people with cancer. And we will have known from previous kits where the peer support and financial assistance teams have spoken to, that their work really has such immense kind of impact at improving the quality of life of people for cancer, which is why we've focused on that particular one. The second area, making it easier for people to access cancer care in regional New South Wales by increasing subsidies for them to be able to travel. Really, this is an area that we have been advocating on for a very long time. Um, we believe that there's some momentum in the area, and some of the momentum is on the back of the parliamentary inquiry into regional healthcare that sort of happened late last year. Many of you would have seen Jeff and Annie's appearance before the Upper House committee into that, and really the inadequacy of IPTAAS, the Isolated Patient Transport Accommodation Assistance Scheme, is very clear, and we fully understand that as an organisation, because we help so many people access that scheme and pick up the slack where it doesn't work through our T2T service. We know that 1 in 5 people in regional New South Wales who have cancer skip healthcare because of costs. And so we really feel that honing in on this particular one is important to do right now. So how have we gone about making this submission? Well, we have in this submission combined evidence of the need for the policy change and for the impact that funding can provide, as well as community stories, which really highlight and give a face to the problems that are out there in the New South Wales community at the moment. So luckily, Cancer Council New South Wales is able to draw on really great pieces of research, including our own studies that we conducted along with the Daffodil Centre, the Peach C19 study, the Clinical Trial Financial Assistance pilot study, really important pieces of work that informs this pre-budget submission, as well as the evidence for impact that we know that our services and programs have. But equally as important as presenting governments with evidence is the human side to it. And so my team has worked with colleagues in the organisation to really highlight some of our community ambassador stories, and work with those community ambassadors who have shared stories on the impact of, for instance, not being eligible for IPTAAS and needing to pay, rely on, support from charities, for instance, to be able to travel and access life-saving treatment. Stories of people who have travelled from, Wagga to Sydney for an intensive course of chemotherapy and have been left with a $7,000 accommodation bill. And of course, stories of, I guess, the wonderful impact that our financial counselling and counselling work has had on the lives of people with cancer. So what's next? How do we really press to government how important these things are. Well, we've got some state and regional media planned. We are, of course, sharing and shopping around this submission with governments, ministers and their staff, and soon we'll be writing to a much broader range of MPs, including opposition and crossbenchers. And of course, we'll be involving community advocates where possible to make sure that we highlight the need for policy change at a local level too. So what can you do? How can you get involved? Well, so because we only just shared the submission with government in the past few weeks, we need to give them a bit of a grace period. So the submission is not public yet, but we envision in the next week it will be. So once it's on our website, I encourage you to give it a read. We will have some social tiles and some messaging in the new and trending section of Story Hub, which can be shared, and I encourage you just to follow along in the weekly news on progress.